Hi everyone, welcome back to the Fem Health channel. Today we are talking about the most common reasons doctors perform an emergency C-section, fetal and maternal distress. If you've ever wondered what fetal distress is, how it's detected, and why it might lead to a quick C-section, stay tuned because I'm going to break it down for you. So what exactly is fetal distress? In simple terms, it means that during the labor, the baby is not getting enough oxygen. This can happen for a variety of reasons, but the bottom line is when doctors notice fetal distress, they may decide that an emergency C-section is the safest and quickest way to deliver your baby. So how do doctors know the baby is in distress? The most common and important sign of fetal distress is an abnormal heartbeat. A baby's heartbeat is usually between 120 and 160 beats per minute during labor. Using an electronic monitor, doctors can track the baby's heartbeat to make sure everything is normal. There are a few things that can tell doctors the baby is in trouble. A heartbeat that is too slow, this is called bradycardia, and a heartbeat that's too fast, called tachycardia. There's also something called late decelerations. This is where the heartbeat drops after a contraction, which can mean that the baby is not getting enough oxygen. Variable decelerations are sudden dips in the heart rate, often caused by the compression of the umbilical cord. When doctors see any of these patterns on the fetal monitor, it's a strong sign that the baby may be in distress and that an emergency C-section may be needed. Another reason for fetal distress are contractions that are happening too close together. If contractions come too close together, the baby doesn't get enough time to recover in between those contractions, which can cut off oxygen and lead to distress. And finally, placental issues like placenta abruption. This can cause serious fetal distress. This is when the placenta detaches from the uterine wall during delivery, cutting off not only oxygen, blood to the baby, and requires an emergency C-section. Sometimes an emergency C-section is caused by problems with the mother's health. Conditions like preeclampsia, which is high maternal blood pressure, can endanger the life of a mother, and expediting your delivery can help your OB take the best care of you. This is a serious situation that requires immediate action, usually in the form of a stat C-section. So, to sum it up, all of these are serious conditions that require immediate attention. Fetal distress is the most common reason for an emergency C-section. It's detected by monitoring the baby's heartbeat, and then second most common is an issue that would be affecting the well-being of the mother. We know that sometimes a C-section is not part of your birth plan, and it can be hard when there's a sudden change or last-minute plans. But when doctors see signs of fetal or maternal distress, they just want to deliver a baby safely and prevent complications. And this may mean going to the operating room for a C-section. I hope this video explains why doctors sometimes need to move fast and pivot towards an emergency C-section. Remember to like and subscribe below, and we will see you next time.